Most people assume that if a joint replacement fails, something went wrong in the operating room. The reality is more uncomfortable than that. Many failures begin long before surgery ever starts. Hi, I'm Dr. Donald Hope, an orthopedic surgeon specializing in hip and knee replacement surgery. I spend a lot of time meeting patients who are frustrated, confused, or scared because their first joint replacement didn't go the way they expected. When the real reasons aren't explained clearly, patients blame themselves, or they assume all joint replacements are unpredictable. Neither of those is true, and misunderstanding this can lead to repeat problems that were actually preventable. By the end of this, you'll understand the most common reasons joint replacements fail, how patient factors and surgical decisions both play a role, and what experienced surgeons do well before the day of surgery to reduce those risks as much as possible. Let's start with what people usually think. Many patients believe joint replacement failure is rare and random. Others believe it only happens because of infection. Infection is one reason, but it's far from the only one. Failure can also happen because the implant loosens, the joint feels unstable, the knee or hip becomes stiff, or the soft tissues never quite work in harmony. These problems don't appear overnight. They develop when small details are missed or misunderstood. One important distinction is patient factors versus surgical factors. Patient factors include things like overall health, weight, bone quality, muscle strength, and even how inflamed or stiff the joint was before surgery. For example, a very stiff knee going into surgery is harder to fully restore than a knee that still moves fairly well. Diabetes, smoking, and poor nutrition can also affect healing and increase infection risk. None of this means surgery should not be done. It means these risks need to be identified and managed ahead of time. Surgical factors are just as critical. Implant positioning matters more than most people realize. A joint replacement is not just about putting in new parts. Those parts must be aligned precisely so forces move through the joint in a natural way. If the alignment is off, even by a small amount, it can lead to uneven wear, loosening, or a feeling that the joint just doesn't quite trust itself. Soft tissue balance is another piece that rarely gets explained to patients. Your ligaments and your muscles, they act like guide wires. If one side is too tight and the other side is too loose, the joint can feel unstable or stiff, even if the implant itself is perfect. Balancing those tissues requires experience, judgment, and sometimes small adjustments that only become clear during surgery. Stiffness is another common concern. Many people assume stiffness means the implant failed. Well, often it means scar tissue formed faster than expected or motion wasn't regained early enough. That's why rehabilitation, pain control, and patient education are not optional extras. They are part of the surgery itself. Here's the shift in thinking that really matters. The most important work in joint replacement happens before the operating room lights ever turn on. Preventing failure starts with planning. That includes optimizing medical conditions, reviewing imaging carefully, selecting the right implant for the individual patient, and planning alignment and balance in advance. It also includes setting realistic expectations so patients understand what recovery should feel like and what warning signs to watch for. A successful joint replacement isn't luck. It's the result of preparation, precision, partnership between the surgeon and the patient. When both sides understand their role, outcomes improve dramatically. If you're researching joint replacement and feeling overwhelmed by stories of success and failure, that's completely normal. The right questions lead to better decisions. Understanding why problems happen is often the first step in preventing them. Take your time, ask for clarity, and focus on preparation just as much as the procedure itself. That's how we give joint replacements the best chance to last and function the way they were intended to. If you enjoyed this video, make sure to like and subscribe to the channel for more videos like this.